May is Mental Health Awareness Month, and today we're shining a light on the importance of caring for our mental and emotional well-being. At Gulfport Behavioral Health System, there's a team dedicated to helping individuals and families navigate challenges like anxiety, depression, and more. We'll talk about the services they offer, how to recognize when it's time to seek help, and why mental health care is just as important as physical health. Good morning. Thanks for joining us on Shop South Mississippi. We're talking with Dean Doty with Gulfport Behavioral. How are you?
Good. Thank you, Chet.
So tell us a little about, for the folks that don't know you or don't know the program that you have, or tell us a little bit about yourself and how you came to be here.
Okay, thank you. I began practicing social work quite some time ago, and got into direct care and working with folks, and then slowly looked into growing in my career, and have served in various roles as therapist, interventionist, clinical director, chief operating officer, and this opportunity came here, and I'm a coast guy, and wanted to try to make Gulfport behavioral health system an even better place than it already was.
Sure, and so he looks very young. Right. You've been doing this for a while. You have plenty of years of experience. So you know firsthand, for those individuals who may be watching that may be questioning if they need to reach out to a professional. You know some of those signs and some of those symptoms that you could share with our viewers right now to help them understand maybe it's a good thing to talk to a specialist.
I tell people that if you think you're depressed, you're probably depressed, or if you think you have an anxiety disorder, you probably do. And for families and friends, I encourage people to look for changes. With children, adolescents, there's a lot of developmental things going on that are normal, and as teens we get broody and moody and all that stuff. But sometimes that is not a normal phase of development. The things to really look out for, like isolation, like sudden isolation, very rapid mood swings, changes in behavior, things that are usually fairly sudden. One thing that's been pretty challenging for our families and our youth is social media. We don't have a personal connection like we used to, like when you and I were growing up.
Sure.
When we would relate to one another, it was in person, but it wasn't via social media, computer, handheld computer. So I encourage people to look for those subtle changes and sudden changes.
I'm glad you mentioned that. You treat children, adolescents, teens, and adults. It's all ages here.
Yes.
So you have folks who specialize in all of those age groups, and because they're all going to be needing a different kind of treatment based on where they are in development.
Right. And so we started age 4 throughout the continuum, and we also not only do we provide inpatient care, we provide outpatient care too. And we recently started an outpatient program for children, ages 7 to 12. And so we've seen in the community there's a real lack of resources and really across the country. And a lot of families had approached us to get help for their loved ones. So we do a lot of group therapy for some of these children to help them with social modeling, peer engagement,
the things that they're missing,
and frustration
because they're in
control.
front of a device.
Yes.
Yeah. Tell us about the importance of getting involved early.
Yes. So when I'm glad you mentioned that, because if we can intervene early, we can disrupt a lot of the obvious issues that are coming down later. And when people have mental health issues or substance abuse issues, they learn how to cope, and they learn how to adjust their lives to try to live as normally as possible with those symptoms. And then there's a subset that will wind up using alcohol or drugs to try to alleviate those symptoms. And so, over time, that will get worse and worse and worse until there's a crisis, or maybe even a death. And that person, if they have the opportunity to get recovery, not only do they have to deal with their substance abuse issue, they have to deal with the precipitating mental health issue, in addition to all the social issues and other dramatics that go along with
Absolutely. You mentioned the Patriot program. Tell us about give us a little breakdown of each of your in-house programs.
Sure. So we have inpatient services. We are a 92-bed inpatient psychiatric hospital that we treat children ages 4 to 12, for teens ages 13 to 17, and then adults 18 and up. And we have one specialized program for our active duty veterans and first responders that is separate from our civilians. And so that is their staff are mostly veterans, and they're highly trained, and we have that military culture within that recovery program.
Sure.
We treat active duty from all over the region.
And that's a big thing here. The Coast Guard, you have
Yes.
the Air Force Base.
Yes.
There are multiple retirement
Yes.
facilities here that are
Yes.
armed forces. So there's a big draw for that. You also have outpatient. You mentioned.
Yes, and so with our outpatient services, like I mentioned, we have a new program for children. We have an outpatient program for adolescents, 13 to 17, and then we have a partial hospital program, which is more intensive than regular outpatient services, and we have a boarding program. So we get people from outside of the area, or people that have a living arrangement that's not conducive to recovery, and then they can live in an apartment and stay there throughout their treatment and have supported housing.
Sure. Tell us about how folks would get access to that care.
Okay.
It's a little different here than a lot of places.
Yes, and so we, as a hospital, we're 24/7, 365, and we have an intake assessment office that is staffed 24/7, 365 with master's level clinicians, and I have people here throughout the day, every day, and I encourage people, if you have a question or if you have a concern for yourself or your loved one, just show up. You don't have to have an appointment. You can have an appointment, but you can show up 24/7, 365, or call our phone number on the screen, 228-831-1700.
Sure. So we have about a minute left. What's some advice that you can give to those families who are trying to navigate these concerns and also maybe dealing with that stigma in the back of their mind?
Yeah, stigma is a huge thing. We so that when we're treating one another and our patients, it's not what's wrong with you, it's what happened to you. Everybody has trauma, whether they're little T's or big T's. Everybody has it, and so I encourage folks to understand that mental health is normal. It's as normal as physical health, and if we ignore it and we don't address it, it will get worse, and it'll bleed into all of our relationships, and it'll affect our lives in a very, very negative way.
And there's 988.
And there's 988. Thank you. And 988's 24/7. It's nationwide, and they can help you with getting a referral to a facility, whether it's us or someone else.
Awesome. Thanks for being with us today.
I appreciate you. Thank you.